Hi, thank you to everyone online for joining us live today in our inaugural Health Tech Thursday. Today's session, Telemedicine Virtual Primary Care, presented by the CSE and KASCorp. We are pleased to have three companies today and one guest moderator. Belchetz from Maple, Navaid Mansuri from Dialogue, and Dr. Sheldon Elman from Carebook, along with Pat McCarthy from Leede Gable, represent today's lineup. Our objective in running Health Tech Thursday is twofold. First, to help digital health technology companies gain visibility and traction on an accessible platform. The second is to help capital markets players and investors sort through the myriad of technology companies in this space by introducing interesting companies, focusing on whether the technology will have commercial traction and why, and also providing new knowledge of what is happening in innovation. For you as attendees, we do ask you share your ideas and feedback with our presenters. Share leads, possible funding after due diligence, referral of someone with unique applicable expertise, or maybe even a potentially strategic relationship. You can find their contact information in the chat board. With respect, we might refrain from giving management advice unless we are truly experts in the company's particular field, and don't treat our presenting companies as marketing targets for services. Some housekeeping matters. You will note a red Reconnect tab at the top of your screen. If you lose audio, just click it and you'll be reconnected. In the event of technical problems, we may hit the restart, in which there will be no action required by you. The system will automatically reconnect everyone. We aim to run 45 minutes to 1 hour. The chat board may be utilized to ask serious questions. Please be clear as to whom your question is being addressed. Note our disclaimer. This presentation is for information only and is not a solicitation to make an investment in either shares or debt or buy and sell stock. The Canadian Securities Exchange, KASCorp, and Barrington Miller as session host, which is yours truly, make no representation about any of these companies. If you are interested in an investor pitch, please connect with the companies directly in order to get detailed information. Each company will have a 6-minute presentation with PowerPoint. When you see my face appear, the company will have 15 seconds to wrap up. After all the companies have presented, we will move to a Q&A. Today, we are privileged to have Pat McCarthy from Leede Gable as our question moderator. And with that, I turn it over to our co-host, Jason Boboikis from KASCorp. All yours, Jason.
Thanks, Barrington. Very excited to be here. A bit about myself and my background. I'm a kinesiologist by training with an MBA in CFA and worked in banking for the large part of my career. Looking at deals, investing, and helping raise capital for companies. And what I saw was a need for more involvement than just getting capital to companies. So we set up KASCorp in 2015 as a merchant bank. And what we look for are exceptional growth companies and management teams we can partner with, and then apply our expertise and network to help grow those businesses. What we recognized a few years ago was that healthcare was a large segment of the economy that had not yet been digitized. And fast forward to today, we're seeing digitization on steroids due to COVID. So we approached the CSE with the idea of putting together a series of talks to really help investors understand how rapidly things are changing. And so without further ado, I'd like to introduce our first company. Dr. Belchetz is co-founder and CEO of Maple, one of Canada's leading 24/7, 365 virtual care platforms. He's not only a doctor, but he has a degree in statistical sciences. He's a senior fellow at the Fraser Institute and was formerly a management consultant with McKinsey. Brett's commitment to medicine and helping others fueled the vision for Maple, who just received a $75 million investment from Loblaw. So without further ado, I'd like to turn the floor over to Brett Belchetz.
Thank you so much for the introduction. Really appreciate it. And thank you to everybody for having me here today. Only have a few minutes to speak to you today, so I'll try to run through these slides relatively quickly. I think the key point that we wanted to get across in terms of starting off the discussion is why we started the company and why what we're doing is so relevant to Canadians. And when we started our company back in 2015, one of the things that was very true then and remains true today is that access to care is an incredible challenge for Canadians. So less than half of Canadians are able to access a primary care appointment within 48 hours of getting sick. And there's a little typo on this slide, but only 2/3 of Canadians are only able to access an appointment within 1 week of getting sick when they have symptoms. So obviously these stats are not good enough, and it actually lands us as having the worst access to care in the developed world. And these are stats for primary care. The stats for specialist care and emergency care are even worse. So there is an enormous opportunity here in Canada that we felt that digital care could access and could harness. And that is that Canadian physicians, despite all of these problems with access to care, were actually working under capacity. So only about 40% of Canada's doctors were actually working fully or full time. And Canadians as a whole were very, very interested in potentially accessing healthcare virtually if it were available. So the entire virtual healthcare industry really takes advantage of the opportunity to harness all of that extra capacity of Canadian healthcare providers to close that gap in access to healthcare. So we started the company, as I mentioned, back in 2015, built our platform from the ground up with proprietary technology. All pieces of the platform are built in-house. And we have really been proud of the growth that we've experienced over the course of the last several years as we've seen virtual healthcare increasingly adopted both before and after the pandemic. So we have the largest network of physicians online in any private healthcare network in the country. So we have thousands of physicians that practice actively on our platform. On our platform is a true multidisciplinary approach to healthcare in a virtual environment. So we have not only general practitioners, but we have specialists from dermatologists to psychiatrists, lactation consultants. We have something that is starting to really approach a multidisciplinary, fully comprehensive healthcare offering in the cloud that is accessible from anywhere in the country. Our core service offers direct connection to general practitioners, and the stat there says under 5 minutes, but our actual average wait time to be speaking to a physician for direct access to care is under 2 minutes. Typically, it's about 1.5 minutes on a 24/7 basis. Our applications are fully bilingual. They're available on the web, on any computer, also available on iOS and Android, and built from the ground up, as I said, in Canada, but built from the ground up with Canada's regulatory environment in mind. And it's a full featured application. So it includes things like digital diagnosis, digital prescribing, the ability for providers to render digital assets like sick notes, create laboratory requisitions, specialist referrals, et cetera. All of these things can be created within the application without the patients or the physicians having to access any other software, any other application. So a truly seamless experience for both patients and providers to provide care and to receive care from anywhere. And one of the things that we're really proud for is just the incredible reception that we get from our patients, be they corporate patients, be they public patients, et cetera. What we tend to see is across hundreds of thousands of reviews of the use of our application over the years that we've been operating, the average rating on consultation stats, and this is the overall experience, same way when you use Uber and you rate your experience after a ride, patients rate our every single usage of our platform after a consultation, and our average rating on these stats is 4.9 out of 5 stars. So something that we're quite proud of and absolutely is vastly superior to any satisfaction ratings that have been seen in the physical healthcare system. So there's a few things that we commonly see our platform used for. So the thing that most people think of when they think of our platform is acute care, and that's that 24/7 general practitioner platform where people need a prescription renewal, they have a sore throat, they have a urinary tract infection, a minor injury, et cetera. And that is definitely the core part of the offering, but over time, we've certainly expanded the suite of offerings. So more and more, we're starting to take care of chronic conditions and provide chronic care. So we offer a full team of not only general practitioners, but specialists and allied health providers that allow collaborative management of multiple chronic conditions, things like high blood pressure, diabetes, asthma, COPD, et cetera, and many other conditions that we have fully multidisciplinary care programs for. The other part of what we do a lot of these days, and this is getting more and more important, I think, especially in the times of the pandemic where mental health is something that everybody is struggling with, is we have a very comprehensive mental health program that includes an entire care team of general practitioners, mental health therapists, psychiatrists, referrals and handoffs to all sorts of other workplace supports like EAP programs. So truly not just a one-sided mental health approach. It is a fully multidisciplinary, comprehensive approach to mental health, making sure that the right care is offered at the right time by the right practitioner. So super easy to use experience. There's a reason why we get great reviews. Our app, I won't get into all the details of the experience. There's a few screenshots there, but we have many patients that are in their 90s effortlessly using our app. And what we've heard is that it's incredibly easy to use, incredibly seamless. And really anybody that can operate a modern smartphone can use our application. And that's something that we're quite proud of. So, we've done a lot to build a very large and very trustworthy group of physicians. So as I mentioned, over 1,000 physicians delivering care on the Mable platform. I won't jump into all of the bullets that are here, but there's multiple things that we go through in terms of making sure that our physicians know how to deliver care safely and appropriately in a virtual environment. Because most physicians, and I am a physician by background, we're never trained to provide virtual care in medical school or in residency. So this is something that every physician needs to learn as an additional part of their practice. So we provide training. We have a medical advisory committee that oversees care and provides care recommendations. We have a quality of care committee. We provide ongoing a whole bunch of other support. And I see I'm almost out of time because I see another video popping up, but I'm just going to quickly go to the end. Basically, this slide just says that we have lots and lots of clients. We've actually got several thousand clients across Canada on our B2B side. We sell to employers and strategic partners. We also license our software out to lots of big public sector players and private players. These are just a few of the people we license our platform out to. And then finally, just some of the numbers. Really excited about our revenue growth, 6.6 times over the last 12 months, great at resolving issues. We have fantastic utilization amongst our corporate clients. Talked about the wait time. Our net promoter score, I think, is the best in the virtual care industry, plus 83 amongst our clients. And we've kept 95% of our corporate clients since the day we opened our doors. So I think I'm definitely over time now, so I'm going to stop speaking. And thank you very much.
And that was great. Thank you so much for that. And I want to encourage our audience not only to listen to these presentations, but visit their websites, contact the companies, find out more information. As well, this will be available on CSE TV, which is on YouTube, as well as I think we're going to do Instagram and it might be LinkedIn as well. So I believe the next presentation is Carebook. So is that correct?
Correct.
I hope so. All right, take it away.
Thank you, Barrington, for doing this, and as Brett says, thank you everybody for the opportunity to present Carebook. And so we're sandwiched in between two very large and very successful and very competent companies. One is Maple, and the other one is Dialogue. Both leaders in the field of telemedicine, and I'm not here to promote them, but I can only tell you that they do a great job. We, however, are sandwiched in between two companies. We are not a telemedicine company, right? And that's an important understanding for everybody. We are really focused on all the people that are on this call, your family members, etc., as to how do you have a platform in your hands, on your cell phone, that allows you to manage your health and your family's health more proactively. Part of that is, hey, when I have a sore throat or I have a urinary tract infection, I will reach out and call somebody. But Carebook becomes the home base of that one website where everything is for you at any time of the day, that you can then transmit that information, be it in Montreal, be it the United States. Hopefully we will all start traveling very shortly, and be it wherever you are in the world, by having that in one really, really succinct package on your cell phone. And how do we do this? Carebook is a powerful health platform, very customer focused for you as an individual. And we do this on behalf of not, and by the way, in our process, the individual, you do not pay for this, which is an even better story. Okay, who pays for people to access this platform and then connect to other people? The pharmacies pay, your insurance companies pay, and not to divulge more information, but to allow you to gain more services from the insurance companies. We have a fantastic population health app for COVID management and post-COVID, and as well for the employer market. And I'll show you very briefly as to how we do this. So as we all know, over the past little while, digital health has has gotten tremendous growth in it, primarily because of COVID. Carebook is the only company today that, in between the other two presenters, that is public. We completed a successful RTO as of the beginning of October, raising $21 million. We are helping to transform the digital health market, not the telemedicine market, okay, by a very innovative product offering that allows people to have consumer engagement and loyalty and all the information that you would need to manage your health and engaging some fantastic vital signs and COVID-19 screening, which I'll show you in 30 seconds. We're poised for growth, and the reason we did go public was to actually expand on a global basis. Canada is extraordinarily well reputed for healthcare, and certainly as we go forward, we have seen many countries and companies on a global basis, including a few of the acquisitions we just announced, where we have customers on a global basis, not just North America. And we're positioning ourselves for that. And we have a very strong management team. I am the executive chair of the company, and as well as the majority owner. All right. I've been a practicing physician for 45 years in Canada. I've seen the good and bad and the ugly. And we have a portfolio of many healthcare companies, many of whom you would know, and including the largest third largest pharmacy company in this country called RX Drug Mart. And how do we do this? We approach you as the individual in the center of everything we do to allow you to gain access to better loyalty and retail services. We have a fantastic industry-leading medication adherence. So why do you go to a pharmacy? Do you take the medication that your doctor has prescribed, etc.? We have all the information necessary for you to engage with that in a very gamified fashion. And with the exception of the two doctors on this call, most doctors are terrible in communicating with their patients. Healthcare has done a pretty lousy job of that. That is changing. And we use gamification that's not putting in bells and whistles and games. And this is really the science and the study of how to use this to have people come back to the app that they want to use. How do they engage with it, and how they use it for their benefit, not the 17 or 20 different consumer-facing apps that a pharmacy chain like Walgreens would have. We combine remote vital signs tracking, which is highly innovative. It's like having the tricorder of Star Trek in your hand today, just in your cell phone. And we're totally committed to privacy and security in the way we have structured this. We are actually compliant with HIPAA in the United States guidelines, with PIPEDA in Canada, and GDPR for Europe. So that speaks to the ability for us to actually deliver our platforms on a global basis. And how do we do this? Carebook has one very solid core platform. Okay, you see at the bottom of the screen, that takes into account all of these functionalities. I will not go through this, etc. But the verticals that we serve are very much the pharmacy sector, not the pharmaceutical sector, the pharmacy sector. And we have partnered with McKesson and Rexall pharmacies in Canada. We have hundreds of thousands of Canadians online for the Be Well app. If you look at it, you won't see very much about Carebook there, but it is powered 100% by Carebook. We own the IP of this. Am I finished already? No.
You have 10 seconds.
Okay. We tackle the employer market, the insurance market as well. So these are the areas that we're doing right now, that we're focusing on right now, and be happy to take you through some of the information about our vital sign scanning. By just using your cell phone, you can scan your face, tell you what your heart rate is, your respiratory rate, your oxygen saturation, no devices on you. It will save your life and those of your family members to manage COVID, to manage high blood pressure, to manage diabetes. It's an unbelievable space-age technology. Thank you for the opportunity.
Thank you so much, Dr. Sheldon, and we definitely appreciate the presentation. Last but not least, Navaid Mansuri from Dialogue.
Good afternoon, everyone. Thank you for inviting Dialogue to participate today, and thank you all for attending. Dialogue was founded in 2016 by 3 visionary leaders, and has, in less than 5 years, has raised more than $100 million from some of the country's biggest institutional investors, and in less than 5 years has grown to be Canada's leader in business-to-business virtual care. It is the only fully integrated health platform in the country, now offering physical health, mental health, and EAP services to a growing list of Canadian businesses, as well as an occupational health and safety offering in Germany. Dialogue is today Canada's third largest EAP provider, with its acquisition of Optima a few weeks ago. Dialogue prides itself in its proprietary and best-in-class technology platform, which provides quick and efficient service to its members while ensuring that a human is always involved in the delivery of care. Through its unparalleled customer success function, Dialogue provides not only excellent care to its patients, resulting in a Net Promoter Score of 75, which also allows Dialogue to actually maintain a net negative churn as a result of account expansion. Our team is now well over 800 men and women, including over 500 medical professionals, serving more than 25,000 corporate customers in Canada and millions of Canadian employees and their families. And we're now doing this all with a clear view of building a business that is on a sustained path to profitability in the next 12 to 24 months. Canada is sometimes seen as the envy of the world due to its universal health care. However, the system has its challenges. Canada spends more per capita and as a percentage of its GDP on healthcare compared to other OECD countries. However, our system consistently ranks near the bottom on several metrics, such as care quality, access, and outcomes. And further, provincial governments are spending more than half of their budgets on healthcare, and this was prior to COVID, and it was expected to more than double over the next 5 years. As a result of COVID, we believe governments will be further challenged to increase the amount of spend in areas such as healthcare, and some of the challenges we discussed earlier in terms of access and quality of care will only become more challenging. And Dialogue reduces the healthcare burden on governments by providing a safe and secure alternative to access the highest quality healthcare funded by employers. Dialogue is the only fully integrated health platform in Canada, which provides clear advantages both to patients and to employers. From a patient perspective, the integration helps ensure the best possible care by providing medical practitioners access to all the patient's history in one place. And from an employer's perspective, having multiple healthcare offerings through one supplier makes the procurement and service much more efficient, which also provides cost synergies from integration as opposed to working with multiple providers. There are many reasons why Dialogue is different from other virtual care offerings. First is our amazing patient experience. We use our AI-powered triage to make the process very efficient for the patient to navigate through and to get to the right medical practitioner as quickly as possible. With a human always in the loop, we provide personal navigation to all patients, and we do follow-ups in 100% of our cases and ensure the patient receives continuity of care. Second, we believe in driving engagement and utilization of our platform. In order for employers to maximize their ROI, employees have to use their platform, have to be engaged. Providing access to employees to a service that nobody uses does not provide any ROI to businesses. And last but not least, we are the leaders in safety and security, which is a huge importance to Canadian businesses. We are SOC 2 certified, and we seriously look after patients' medical records, as well as ensuring all aspects of cybersecurity. As I mentioned earlier, Dialogue has its own proprietary and secure technology platform, which guides the patient through the journey and gets them to the best medical resource in the shortest amount of time. The technology is not the one making decisions for patients. Those are all decisions and diagnoses are done by licensed medical professionals, but our technology allows them to be more effective and efficient in the delivery of care. And even though we use technology, our approach to healthcare is always to have a human in the loop, which, when combined with our data pools, allows us to achieve a much bigger scale. The patient always receives healthcare from a human, but in the background, the technology makes the process much more safe and much more efficient. So that's a summary of how Dialogue has, in 5 years, become the leading Canadian B2B virtual care platform. We continue to experience significant growth, and COVID has only accelerated that growth. And through a combination of organic growth within Canada and international, as well as continuing our acquisition strategy, we continue to, we look forward to solidifying our position as the Canadian leader in virtual healthcare. Thank you very much for your time.
Thank you so much for that. And thank you to all our presenters. You did a great job, especially sticking to the timelines. So at this point, I would like to invite all of our presenters back to the main stage, as well as our Q&A moderator, Pat McCarthy. And this is what we call the Inquisition. If you've been following Tech Tuesdays, and if you've been a fan, you'll know what this part is. We ask hard questions, we ask difficult questions, we ask uncomfortable questions. No, I'm kidding. It's not that serious. The questions are fair and firm. We encourage our audience to also participate. Feel free to put your questions down in the Q&A. And without further ado, I'm turning it over to Pat McCarthy, Leede Jones Gable.
Thanks, Barrington. I think everybody is trying to get their head around this new world of virtual healthcare. Maybe Brett can address this one. How much of the total percentage of doctor visits are virtual, now, and where can that grow to over time?
Well, thanks so much for the question. And I wouldn't be able to give you the exact stat for right now. The most recent stat that we have is for April of 2020. So at the height of the first wave of the pandemic, there was some good surveys that were done by the Canadian Medical Association and by Canada Health Infoway that showed that during the month of April, 70% of all medical visits, 70% of all physician visits in Canada were actually performed virtually, which is a stunning increase in the percentage of visits done virtually versus pre-pandemic levels. If we were to look at the same stat prior to the pandemic, what we would typically see is somewhere under about 5% of all visits being done in the country being performed virtually. So we've gone from this being very much a fringe experience to something that is the majority of healthcare. Now, since those stats from April, what we've seen is we've seen a lot of doctors returning to their offices, a lot of patients returning to their offices, but still virtual care has continued to see massive uptake versus what we saw before the pandemic. The question really is, what's the steady state? What will the percentage be in the long run if we continue to see strong adoption at the same time as having no pandemic and people not being afraid to go to the doctor's office? And I think the best stat that we have from the world is one that I always like to reference, which is from Kaiser Permanente, which is one of the largest hospital systems in the world. They're located in the United States, and they've been pushing virtual for a long period of time, even before the pandemic. And their steady state stat is somewhere around 50% of all their healthcare visits being performed virtually. And so I think that's a good number for us all to strive for. And it aligns well with research that's been done by various medical schools, as well as medical authorities and the American Medical Association down south of the border, where it's been estimated that about 50 to 70% of all visits could be performed virtually in a perfect world.
If I may just hop in for 1 second on this. One of the other healthcare professionals that is actively involved in your health is not just the physician. There's a limited amount of them. There's many, many more pharmacists. And if you look at what's going to be happening with the distribution of the vaccines everywhere in the world, the pharmacies are going to be playing an integral role in vaccinating 8 billion people. But they don't have a platform to reach out and talk to these people. And the same way that now telemedicine does. One of the things that a company like ours does is to empower the pharmacist for effectively doing telepharmacy, etc. So one has to think of how, in this new COVID world and post-COVID world, how are we going to use healthcare professionals properly, and the digitization of all of that. So to reaffirm what Brett is saying, this is critically important for the health of not just Canadians, but everybody.
Great. So it helps quite a bit that the Ontario government is now allowing doctors to get paid for doing telemedicine visits, which is just new during COVID. Do you think that's going to get extended?
I think there's no doubt that's going to be extended. I think the genie is out of the bottle. I think most people, having experienced how much better virtual care is for basic medical needs, and even for sometimes for complex care needs, I think having experienced, what it's like to see a doctor without having to travel across town, without having to sit in a waiting room with somebody coughing on you right next to you for several hours. It's very hard to tell people now that the pandemic's over. Now you have to go back to all of those terrible parts of the experience. And the indications that we've had through numerous discussions with governments, not just in Ontario, but across the country, is that most governments are going down a path towards permanent public funding for some form of virtual care.
Yeah, I spoke to my physician last night to prepare for this, and she told me that the rate of adoption in Ontario is escalating to the point where I think Sunnybrook's Emergency is now doing e-consults, which is an interesting one.
The only thing I would add to that is government's funding virtual medicine won't solve some of the challenges that we talked about in terms of access and things like that. So even though telemedicine it does get funded, or if it does get funded across the country, access will still remain a challenge within the Canadian system.
Okay. I second that, but I think though that the gravy days of the governments paying for 100% of telemedicine's fees, we're already seeing both in Ontario and Quebec, the governments are saying, hey, we only have a limited amount of money. We're actually cutting back on the fee schedule. So the gravy days are somewhat behind us. So it will be probably a little bit of that and a little bit of that, where we're going to have a combination of the ability for people to pay and governments to pay, but it's not going to be all on the government's ticket.
Or in the case of Dialogue employers.
Absolutely.
Navaid, what's the issue with access? Is it just the country is so geographically diverse, it's hard for people to get access, or what's the problem?
There's a number of challenges. I think supply of medical professionals it varies across the country, but in some provinces it's less challenging than others. But I think the biggest challenge is with an aging population and the limited supply that we have of medical professionals. I think that's what's created the challenge. I moved back from Ontario about 4 years ago, and I still haven't been able to get a family doctor. And that's just one example, but there's many people like that in similar situations. So I think it's largely due to a shortage of or a limited supply of medical professionals.
So is that a challenge building out the platform? Recruiting doctors.
It is. I mean, it is absolutely a challenge. I think what Dialogue has done successfully, as well as some of the other platforms, is with virtual. You're able to access physicians, for example, if they're in their clinic and they want to take 2 hours or 4 hours to serve on a virtual platform. You could have somebody who's on maternity leave, who's taking time off to spend time with their children, and she wants to do it from home, or he or she wants to do it from home. So it offers actually flexibility, and in some cases could bring some people back into the system or into the healthcare system, not in the public system, that would otherwise not be available to provide healthcare. So it cuts both ways.
Having to take time off work to book a doctor's appointment, sort of the elimination of that waiting room experience. Are you guys seeing lots of positive feedback on that end?
75 compared to the healthcare industry average of 24 just tells you a little bit about how satisfied patients were with the adoption. So as more people try it, they're delighted with the service and want to keep using it. And COVID has actually accelerated the adoption. So we don't see that slowing down or returning to pre-COVID levels.
Yeah, I'll agree with that as well. I mean, I think there's just no question that people are delighted by the virtual experience, and they're starting to see an entire range of healthcare issues that they ordinarily would have booked in an appointment to go to an in-person practitioner for, that now they realize they can fully address virtually. I think people are skeptical the first time they tried, because everybody asked the question, how can a doctor or any healthcare provider take care of me without touching me? And I think very quickly, once they've tried it once, they realize that, wait a second, most of what a doctor does is take a really good history. Most diagnosis can be done visually, and the ability to order tests and make referrals and all these other things are intact in the virtual world. So very quickly that skepticism disappears, and when people realize it works, they keep doing it over and over again. The other thing, that good parallel I like to draw is, in the old days before the pandemic, before everybody was working from home, you would have to take half of a day off of work if you had the plumber coming to your apartment. You'd have to cancel off work so the plumber could come in and actually fix what your problem was, and then you go back to work. And we don't see that anymore. People have contractors come into their homes while they're working from home, and we realize it's 2 minutes away from your video call, and then you come back. And I think what virtual healthcare has done, it's done the same thing for the healthcare side of the experience, meaning, you used to have to take half a day off of work to go see the doctor, and now, it's 5 minutes out of your video call, and then you're back at work. So the productivity gains that workplaces are seeing as a result of employees not having to leave the workplace, but also employees actually not having the stress over a healthcare issue that's not getting addressed. Because one of the biggest issues we see is not only the half day of work that people had to take off, but it was the 3 days of waiting, not knowing what was wrong with them, and potentially feeling terrible where they were at the office, where they weren't productive at all. We've gotten rid of all of that. And so it's a huge gain for everybody.
But in addition, though, if I may add, the most contacted person in the healthcare system is the pharmacist, because we all go into a pharmacy across the country many times more than we actually go see a physician, me being one of those doctors, etc. And as such, there was no mechanism for that to happen. So in our model, what happens is the pharmacy actually pays us rather than the individual to provide that platform to allow that pharmacist to reach out now and be part of the integrated network of healthcare delivery. So it's a very, very different model, both from the payer standpoint and from the consumer's appreciation of having access to a whole other dimension, not just the physicians, but now a resource that they can access and get their questions answered.
So thanks for that. So maybe everyone can chime in on that.
I'll start. Dialogue already is international. As I mentioned, we have an occupational health and safety offering in Germany, which we're taking a traditional business and leveraging using our technology platform to open up the TAM, not just in Germany, but in other markets. But then because we have our technology built out, we can take our additional services, whether it's mental health, whether it's EAP, export them to Germany and to other markets. Conversely, bring occupational health and safety to Canada. But yes, in the short term, I think in the short to medium term, we're focused on continuing to solidify our leadership position in Canada and expanding our international offerings, starting with Germany and then other markets as those opportunities arise.
On the Carebook, on the Carebook side, we have a little under 4 million active customers, and a little bit under 1 million of these are outside of Canada already. And when you look at some of the underserved countries, by being able to provide this in Asia Pac, in India, and in Europe, the opportunity for global expansion is tailor-made.
Yeah, I'll say that the Canadian market is fairly sizable just to begin with. I definitely believe that there will be some consolidation in this market, but if you look at just the number of physician visits, there's about 200 million physician visits per year in Canada. And if you believe that 50% of those visits can be done online, that's 100 million visits up for grabs every single year. And half of those visits are typically specialist visits. Half of them are general practitioner visits. There's different ways to put a dollar figure on what those visits will, work out to when you try to figure out the TAM. But, even if we're really conservative and we say, average visit cost of $50, which is probably a little bit low given the way that some of these things are paid for, that's a $5 billion market just off of the top of my head in terms of calculation. And that doesn't even account for allied health providers, pharmacists, and all sorts of other types of healthcare experiences that should be virtualized as well. So I think the market is quite substantial. And again, really the question is, what is your level of ambition? If you have a certain level of ambition, this is a big enough market to start in and stay in. If you have global ambitions, then there's lots of opportunities to take your services outside of Canada if you're succeeding here. And, we already have a limited offering in the United States, which we may expand later in time. We're already licensing our platform out to buyers outside of the country. And there's incredible opportunities for us to expand all of these services, such as offering direct service and software licensing of the platform around the world. So we think the future is really bright in terms of the Canadian market, but also the global market and our opportunity to take Canadian technology and know-how and win in other places that we could go to.
Brett, thank you. That's a great answer. It's having a metric like 200 million physician visits a year really gives me a better understanding. Thank you.
Hi. Usually it's my presence is it's time, but it's not. We have questions coming in from the audience.
Why don't you field those, Barrington?
Yeah. This one's, it's basically a two-parter statistic question. Are there any statistics on time saving for professionals not having to wait for doctors behind schedule? And any stats on time saving for professionals? Oh, sorry, it was repeated. Just one. And the other ones are, how do these platforms monitor the patient health outcomes after a patient is provided care for both physical and mental issues? How do you handle the physical aspects of treating patients, examining wounds, getting blood tests remotely? And this one's specific for Carebook. What's with Carebook's ability to read vital signs? How does that work? So take it away. Stats, platforms to monitor patient health outcomes, and how do you handle the physical treating of patients? And Carebook, your ability to read vitals. So take it away in whatever order you want.
That's a lot of questions. I can jump in on the stats, which is a fairly easy one to look at. The average Canadian sees the doctor about 6 times per year. And that's going to vary. Obviously, you see the doctor the most if you're a young baby, and you see the doctor the most if you're an elderly adult. And in between those years, you have fewer average visits. But if we assume that there's 6 visits per year per person, if you look at the fact that about 50% of those visits can be done online, that's about 3 visits that can be done online. Each of those visits in the previous world would have been about a half day off of work, or a half day, including travel and waiting room time and everything else. And with our average wait time right now at about a minute and a half, it's essentially getting rid of all of that time. So, really what you're looking at is for the average person who's using the platform regularly, you're looking at about 1.5 days of workday savings every single year that they're using the platform, and that's pretty considerable when you look at in terms of the dollar value of that savings. If you look at the average rate of productivity per hour of a Canadian employee is about $60 per hour. So if you're looking at an 8-hour workday, 12 hours of productivity that are saved per year, that's multiply that up by your 60. That's about 6,000
devices and remote monitoring. I think there are technological advancements being made on all of those fronts, and they will be more and more available through virtual platforms. We've provided those in some cases, or work with our employer partners to develop on-site clinics in some examples, and to have remote monitoring. So there's definitely technology enhancements being made in those areas. And they will become part of the virtual delivery in the coming months and years.
I'll just fix my quick math. I think it was $720. I was way off on my quick math. So never ask me to do calculations while I'm speaking and thinking through something at the same time. And then on the remote examination point, I'll just say that as a physician, as I mentioned earlier, most diagnosis does not require physical touching. You can do the vast majority of diagnosis through high resolution video, high resolution photography. I can do most of the physical examination by walking a patient through a physical exam on video. There are incredible peripheral devices that now allow us to listen to patients' lungs remotely, look in their ears remotely, look in their throats very easily remotely. Almost all the parts of the physical exam can be done remotely other than actually physically touching. So not going to be there for 100% of cases, but 50 to 70% of cases, we can do everything we need to do without actually physically being in the room with the patient. And again, I'll go back to that Kaiser stat because there's a lot of doubters that say, I just don't believe it works. And what I would say is if you look at the Kaiser example where they literally do millions of visits per year at Kaiser, and 50% of those visits have been done virtually for years, they have seen no difference in the level of outcomes between the virtual visits and the in-person visits. So no difference in terms of diagnostic accuracy, no difference in terms of litigation or patient complaints. The only difference that they've really seen is that the patients and the providers are actually happier in the virtual visit. So I think it's one of the world's largest study populations for the safety of virtually, and I think it's turned out quite awesome.
So if I can jump in, because I know time is moving, but Brett, thank you. That's a great intro into monitoring vital signs using your cell phone, no wearable device, nothing else. And the same technology is running in the back of an Apple Watch, but not on your watch. Look in your cell phone and get your heart rate, your respiratory rate, your oxygen saturation, your mental stress level, and it'll save your life because it'll tell you how you're managing COVID or not. It'll manage your blood pressure virtually. Only 15% of people in North America have a wearable device like an Apple Watch or a Fitbit or a Garmin, but virtually 100% of people have this little device, and this will save your life, and that's embedded in Carebook technology.
Well, this time my appearance does mean we are running out of time. If I could have, thank you, everyone. Thank you to our panelists, and of course to our moderator, Pat McCarthy from Leede Jones Gable. On behalf of the Canadian Securities Exchange and KASCorp, I just want to say thank you for appearing today. For our audience members, please go to their websites. Please visit them. Thank you for taking the time, audience, to listen to this story, to listen to several other stories. I'm going to bring Jason back for closing remarks, but next week, check out Chronic Care and Prevention. So it's going to be same time, 1:15 Eastern Standard Time. We'll go 45 minutes to an hour, and we're going to continue this. But without further ado, I'm bringing back Jason.
Barrington, I think you stole all my thunder. You said everything that I wanted to say. Thanks to everybody that participated. Next week on Chronic Care and Prevention, we're featuring 3 companies, Nutopia, Welltech, and Curatio. That session will be hosted by guest moderator Mark Kohler, who is chairman of CloudMD. So hopefully everyone can make it. Thanks again.